And welcome back. The CDC is warning of the possibility of a bad 2021-22 flu season because of a lower population immunity to viruses, which were less in circulation last winter, and they're urging people to get the annual seasonal flu shot as an essential part of protecting their health. Now, while the world is battling COVID-19 this past year, there was a lull in flu activity, but experts warn that can only be temporary. Joining us now to share more details is the medical director at Healthfirst, Karen Costley. And Karen, glad to have you.
Thank you for having me.
So there is some concern. I mean, when we talk about the flu season, a lot of us are just really trying to navigate COVID, the Delta variant, and the other variants, but we also still have to pay very close attention to flu season. What can you tell us about what we can anticipate coming forward?
Well, due to the pandemic precautions that have been lifted, we expect the flu to be much more prevalent this season. So it's going to be important to use every protection we have possible to prevent that. So the flu vaccine is going to be very important this year.
And as the flu vaccine is important, talk about who should be the ones to actually get the flu shot.
So anybody over the age of 6 months who has not had a severe allergic reaction to the flu shot should be getting it this year. And this is the time to get it. Usually now through mid-October, early November is the most optimal time to get it, but we expect the flu to be circulating through March. So anytime you can get the vaccine, please get it.
Yeah. And so for common information, talk to us about the flu. We know how the coronavirus is spreading and what causes that virus to actually spread. But when we talk about flu, how does that work?
Well, the flu spreads similarly to the coronavirus in that it can spread through droplets when people cough or sneeze or laugh, and it can affect your upper airways, and it can also lead to more severe disease in your lungs and even superinfection with bacterial infections, pneumonia that requires hospitalization and even ventilation. So to prevent any of those symptoms and to prevent severe flu, we would like people to get vaccinated and to practice the precautions that we've all been practicing because of COVID.
Yeah, you use that optimum word, which is symptoms, and sometimes people can not pay attention to some of the symptoms, but what are the symptoms connected when it comes to the flu?
So mild disease will have upper respiratory symptoms, cold, feeling sinus congestion, headaches, feverish, malaise. But some people will have severe infections and they'll have shortness of breath and chest pressure and severe malaise and require hospitalization. So if you're having any symptoms that you're concerned about, we would really encourage you to speak to your physician or healthcare provider and seek medical attention. But if you're having mild symptoms, you can treat it as you would a common cold and just rest fluids and medication as necessary for fever.
Yeah, we hear about the positive benefits that are associated when you take the shot for the virus right now, but what are the benefits for taking the flu shot?
So the flu shot helps prevent you from developing severe disease or needing hospitalization, and it also helps prevent you from infecting your family, your community, your coworkers. So we encourage everybody to get vaccinated with the flu vaccine and the COVID vaccine.
Yeah, you talk about flu and COVID vaccine, but I know a lot of people say, listen, once I got the COVID vaccine, I'm good. I should be, protected against the flu. And we know that's not so. But can you break down the difference between, if you will, that COVID-19 vaccine and then what we get with the flu shot?
Sure. So the flu is caused by the influenza virus, and the vaccine is really to protect you against the influenza virus. The COVID vaccine is to protect you against the coronavirus. So they're two different viruses that both can cause respiratory illness of mild severity to severe severity. So we would like you to be protected as well protected as possible against both. And that would require taking both vaccines.
Yeah. Can you debunk a myth for me? Because I hear a lot of times people say, well, listen, if I get the flu shot, that it really puts me more at risk for getting COVID-19 because my immune system is lower. I know you've heard that before. Share with us a little bit about that myth that you've heard.
So you will not be more apt to get the coronavirus if you get the flu shot. both of these vaccines are prompting your body to make antibodies against each of the viruses. And they're different viruses, so they're actually getting your body to make viruses against each. So one does not make the other more infectious or you apt to get a more severe disease if you get infected with the other virus. So get the flu vaccine to protect yourself against the influenza virus, and get the COVID vaccine to protect yourself against the coronavirus.
Yeah. And Karen, I know there's some people have this aversion to needles, so they're, really hesitant about even first getting the COVID-19 vaccine. But when you talk about the COVID-19 vaccine, flu vaccine, are there something that I can get separate, or is it something that I can do actually at the same time?
So you can get both at the same time, and many pharmacies have both vaccines available to give, some provider offices as well, but you can actually get both at the same time. The CDC has issued guidance saying that we can get both at the same time.
Yeah. We hear about tips to help us out and what can help us out during the time of coronavirus. What can you tell us to really help us to avoid going down the path of catching a flu or, transmitting a flu during this season?
I would suggest practicing the precautions that we've all been practicing for the last year and a half, wearing masks if you're indoors, frequent hand washing, social distancing when possible. But the best protection you can give yourselves is really to get the vaccine. So I encourage you to do that.
Yeah. What are we finding so far? Are we finding that more people are actually coming in to get the vaccine, or are we seeing still a little hesitancy and delay?
Well, this is early in the season. Last year, we did see, I think the Bronx was only second to Manhattan in the number of percentage of people getting vaccinated. But again, this is early, this September, the flu vaccine just became available. So we're hopeful that we'll get really good numbers this year and that we won't see a lot of flu circulating because there's enough COVID circulating. We don't need that on top of it.
Yeah. And if a person does happen to contract the flu, what advice do you give them after a person has contracted the flu?
So you need to stay to rest and take it easy and to practice precautions that you would as you would with any other infectious disease. So you don't want to be close to anybody. You want to be practicing distancing. You want to be staying hydrated and resting. Remember, it's transmitted through droplets when you sneeze or cough. So again, you don't want to cough into your hand and touch anything, cough into your elbow, wash your hands frequently, and stay hydrated.
Yeah. Karen, some real good information. Hopefully our viewers will take full advantage. Hopefully we debunked a couple of myths and we can see more and more people get vaccinated for the flu vaccine during this season. Thank you so much for joining us.
Thank you for having me. Appreciate it. Have a great
All
day.
righty. Karen Costley, our guest here. Now, if you want more information, we encourage you, please visit the website, and that's at healthfirst.org, and then also on social media at healthfirstny. We encourage you, don't go anywhere. We've got more show coming up. Open continues coming up right after this.